Question 1. A 72-year-old client with a history of chronic kidney disease is admitted with confusion, weight gain of 3 kilograms in 48 hours, and decreased urine output. Assessment reveals jugular venous distension, bounding pulses, and bilateral crackles on auscultation. Which pathophysiological mechanism best explains these findings? A. Loss of intravascular fluid leading to decreased preload. B. Excess extracellular fluid causing increased hydrostatic pressure. C. Increased oncotic pressure pulling fluid into the vasculature. D. Decreased aldosterone causing sodium and water loss. Answer. B. Excess extracellular fluid causing increased hydrostatic pressure. Rationale: the client demonstrates classic signs of fluid volume excess, FVE, including rapid weight gain, JVD, and pulmonary congestion. Increased hydrostatic pressure forces fluid out of the vascular space into interstitial tissues, leading to edema and crackles. Question 2. A postoperative client develops tachycardia, hypotension, dry mucous membranes, and decreased urine output. Which laboratory finding would the nurse anticipate? A. Decreased hematocrit. B. Decreased serum sodium. C. Increased hematocrit. D. Increased BNP. Answer. C. Increased hematocrit. Rationale: fluid volume deficit, FVD, leads to hemoconcentration, resulting in increased hematocrit. The clinical signs, tachycardia, hypotension, oliguria, support hypovolemia. Question 3. A client with heart failure is receiving 4 fluids at 150 milliliters per hour. Which assessment finding requires immediate intervention? A. Urine output of 40 milliliters per hour. B. Blood pressure of 140/88 mmHg. C. New onset crackles in lung bases. D. Mild dependent edema. Answer. C. New onset crackles in lung bases. Rationale: crackles indicate fluid accumulation in the lungs and worsening fluid overload. This is an early but critical sign of pulmonary edema requiring immediate action. Question 4. A nurse is assessing a client with suspected dehydration. Which finding is most specific to fluid volume deficit rather than fluid volume excess? A. Peripheral edema. B. Distended neck veins. C. Orthostatic hypotension. D. Bounding pulse. Answer. C. Orthostatic hypotension. Rationale: orthostatic hypotension is a hallmark sign of fluid volume deficit due to decreased circulating volume, unlike findings associated with excess such as edema or JVD. Question 5. A client with severe vomiting for 3 days presents with confusion and tachycardia. Which acid-base imbalance is most likely associated with this condition? A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Answer. C. Metabolic alkalosis. Rationale: prolonged vomiting leads to loss of gastric acid, HCl, resulting in metabolic alkalosis, often seen with fluid volume deficit. Question 6. A client receiving large volume 4 fluids develops sudden weight gain and shortness of breath. Which diagnostic test is most useful in confirming fluid overload? A. Serum potassium. B. BNP level. C. Hemoglobin level. D. Urine-specific gravity. Answer. B. BNP level. Rationale: BNP, B-type natriuretic peptide, increases in response to ventricular stretch due to fluid overload, making it a sensitive marker for fluid volume excess. Question 7. A client with burns covering 40% of the body is at risk for which type of fluid imbalance during the initial phase? A. Fluid volume excess due to capillary leak. B. Fluid volume deficit due to fluid shifts. C. Hypervolemia due to sodium retention. D. Euvolemia due to compensatory mechanisms. Answer. B. Fluid volume deficit due to fluid shifts. Rationale: in burn injuries, fluid shifts from the intravascular to interstitial space, third spacing, leading to hypovolemia despite total body fluid presence. Question 8. A client with SIAD presents with confusion, weight gain, and low serum osmolality. Which fluid imbalance is present? A. Fluid volume deficit. B. Fluid volume excess. C. Dehydration without volume change. D. Isotonic fluid loss. Answer: B. Fluid volume excess. Rationale: SIAD causes water retention leading to dilutional hyponatremia and fluid volume excess, evidenced by low osmolality and weight gain. Question 9. Which assessment finding best differentiates fluid volume excess from fluid volume deficit? A. Increased heart rate. B. Decreased urine output. C. Presence of pulmonary crackles. D. Altered mental status. Answer: C. Presence of pulmonary crackles. Rationale: crackles are specific to fluid accumulation in the lungs, strongly indicating fluid volume excess, unlike nonspecific signs like tachycardia or confusion. Question 10. A client in hypovolemic shock is being assessed. Which hemodynamic parameter is expected? A. Increased central venous pressure. B. Decreased cardiac output. C. Increased pulmonary capillary wedge pressure. D. Decreased systemic vascular resistance. Answer: B. Decreased cardiac output. Rationale: hypovolemia leads to reduced preload, resulting in decreased cardiac output. CVP and PCWP are also decreased, while SVR increases as compensation. Question 11. A client with uncontrolled diabetes mellitus presents with polyuria, polydipsia, dry skin, and tachycardia. Which mechanism is primarily responsible for this fluid imbalance? A. Increased ADH secretion causing water retention. B. Osmotic diuresis leading to excessive fluid loss. C. Sodium retention due to aldosterone excess. D. Decreased glomerular filtration rate. Answer: B. Osmotic diuresis leading to excessive fluid loss. Rationale: hyperglycemia causes glucose to spill into urine, pulling water with it, osmotic diuresis, resulting in significant fluid volume deficit. Question 12. A nurse is assessing a client with fluid volume excess. Which finding indicates worsening condition requiring immediate intervention? A. Mild ankle edema. B. Blood pressure of 150/90 mmHg. C. Pink frothy sputum. D. Weight gain of 0.5 kilograms in 24 hours. Answer: C. Pink frothy sputum. Rationale: pink frothy sputum is a sign of acute pulmonary edema, a life-threatening complication of fluid overload requiring immediate action. Question 13. A client with prolonged diarrhea presents with hypotension and tachycardia. Which electrolyte imbalance is most likely to accompany this fluid deficit? A. Hypernatremia. B. Hyponatremia. C. Hyperkalemia. D. Hypercalcemia. Answer: B. Hyponatremia. Rationale: diarrhea leads to loss of sodium-rich intestinal fluids, resulting in hyponatremia along with fluid volume deficit. Question 14. A client with cirrhosis develops ascites and peripheral edema despite low intravascular volume. This condition is best described as A. True hypervolemia. B. Relative hypovolemia due to third spacing. C. Dehydration from fluid loss. D. Isotonic fluid excess. Answer: B. Relative hypovolemia due to third spacing. Rationale: fluid shifts into the peritoneal cavity, ascites, reduce effective circulating volume, causing hypovolemia despite total body fluid excess. Question 15. Which laboratory finding is most consistent with fluid volume excess? A. Elevated hematocrit. B. Increased urine-specific gravity. C. Decreased serum sodium due to dilution. D. Increased BUN due to dehydration. Answer. C. Decreased serum sodium due to dilution. Rationale: fluid overload dilutes serum electrolytes, leading to dilutional hyponatremia. Question 16. A trauma client with acute blood loss exhibits cool clammy skin and delayed capillary refill. Which compensatory mechanism is responsible? A. Vasodilation to improve tissue perfusion. B. Increased parasympathetic stimulation. C. Peripheral vasoconstriction to maintain core perfusion. D. Decreased heart rate to conserve oxygen. Answer. C. Peripheral vasoconstriction to maintain core perfusion. Rationale: in hypovolemia, the body constricts peripheral vessels to preserve blood flow to vital organs. Question 17. A client receiving diuretics develops dizziness upon standing. Which assessment finding supports fluid volume deficit? A. Bounding pulses. B. Weight gain. C. Orthostatic hypotension. D. Jugular venous distension. Answer. C. Orthostatic hypotension. Rationale: diuretics can cause excessive fluid loss leading to hypovolemia, evidenced by orthostatic hypotension. Question 18. A client with renal failure has fluid retention. Which assessment finding correlates most directly with decreased renal excretion? A. Increased urine output. B. Peripheral edema. C. Dry mucous membranes. D. Flat neck veins. Answer. B. Peripheral edema. Rationale: impaired renal excretion leads to accumulation of fluid in tissues, causing edema. Question 19. A nurse is evaluating a client's intake and output. Which finding suggests fluid volume deficit? A. Intake exceeds output by 800 milliliters. B. Urine output less than 30 milliliters per hour. C. Presence of crackles. D. Sudden weight gain. Answer. B. Urine output less than 30 milliliters per hour. Rationale: oliguria is a key indicator of decreased renal perfusion due to hypovolemia. Question 20. A client with fluid overload is placed on fluid restriction. Which outcome indicates effective therapy? A. Increased heart rate. B. Decreased edema. C. Decreased hematocrit. D. Increased blood pressure. Answer. B. Decreased edema. Rationale: reduction in edema indicates that excess fluid is being effectively managed and removed. Question 21. A critically ill client develops third spacing following severe pancreatitis. Which assessment finding best indicates that intravascular fluid volume is compromised despite total body fluid excess? A. Generalized edema with stable blood pressure. B. Hypotension with decreased central venous pressure. C. Bounding pulses with increased urine output. D. Hypertension with jugular venous distension. Answer. B. Hypotension with decreased central venous pressure. Rationale: third spacing traps fluid in non-functional spaces, reducing circulating volume. This leads to hypotension and low CVP despite visible edema. Question 22. A client with fluid volume deficit is receiving isotonic 4 fluids. Which parameter best indicates adequate fluid resuscitation? A. Urine output greater than or equal to 0.5 milliliters per kilogram per hour. B. Decreasing hematocrit below normal. C. Development of peripheral edema. D. Increase in respiratory rate. Answer. A. Urine output greater than or equal to 0.5 milliliters per kilogram per hour. Rationale: Adequate urine output reflects improved renal perfusion and is a primary indicator of successful fluid resuscitation. Question 23. A client presents with confusion, weak thready pulse, and delayed capillary refill. Which stage of fluid volume deficit is most likely? A. Mild deficit. B. Moderate deficit. C. Severe deficit. D. Compensated equilibrium. Answer. C. Severe deficit. Rationale: neurological changes and poor perfusion, weak pulse, delayed refill. Indicate advanced hypovolemia and impending shock. Question 24. A nurse is caring for a client with heart failure receiving loop diuretics. Which finding indicates overcorrection leading to fluid volume deficit? A. Persistent edema. B. Crackles on auscultation. C. Sudden weight loss with dizziness. D. Elevated BNP levels. Answer. C. Sudden weight loss with dizziness. Rationale: excessive diuresis can lead to hypovolemia, manifested by rapid weight loss and orthostatic symptoms. Question 25. A client with SIAD is at risk for which complication related to fluid volume excess? A. Hypernatremia. B. Cerebral edema. C. Metabolic acidosis. D. Hypokalemia. Answer. B. Cerebral edema. Rationale: water retention dilutes sodium, causing hyponatremia, and fluid shifts into brain cells, leading to cerebral edema. Question 26. A postoperative client develops fluid overload. Which intervention is the nurse's priority? A. Encourage oral fluid intake. B. Elevate lower extremities. C. Administer prescribed diuretics. D. Increase infusion rate. Answer. C. Administer prescribed diuretics. Rationale: diuretics remove excess fluid and are the primary intervention for managing fluid volume excess. Question 27. A client with dehydration has a serum osmolality of 310 mosm/kg. How should this finding be interpreted? A. Normal finding. B. Indicates fluid volume excess. C. Indicates fluid volume deficit. D. Suggests isotonic balance. Answer. C. Indicates fluid volume deficit. Rationale: elevated serum osmolality reflects concentrated blood due to water loss, consistent with dehydration. Question 28. A client with fluid overload shows a decrease in oxygen saturation. What is the underlying cause? A. Reduced hemoglobin levels. B. Fluid accumulation in alveoli impairing gas exchange. C. Increased metabolic demand. D. Decreased cardiac workload. Answer. B. Fluid accumulation in alveoli impairing gas exchange. Rationale: pulmonary edema interferes with oxygen diffusion, leading to decreased oxygen saturation. Question 29. A nurse is differentiating between fluid volume deficit and excess. Which vital sign pattern is most consistent with hypovolemia? A. Hypertension and bradycardia. B. Tachycardia and hypotension. C. Bradycardia and hypertension. D. Tachycardia and hypertension. Answer. B. Tachycardia and hypotension. Rationale: hypovolemia leads to decreased circulating volume, causing hypotension with compensatory tachycardia. Question 30. A client with renal failure is unable to excrete excess fluids. Which complication is most likely if fluid volume excess is not managed? A. Hypovolemic shock. B. Pulmonary edema. C. Metabolic alkalosis. D. Hypercalcemia. Answer. B. Pulmonary edema. Rationale: fluid accumulation in the lungs is a life-threatening complication of untreated fluid overload. Question 31. A client with severe dehydration secondary to heat stroke presents with tachycardia, hypotension, and altered mental status. Which additional finding would the nurse expect? A. Decreased serum sodium. B. Increased urine output. C. Elevated serum osmolality. D. Bounding peripheral pulses. Answer. C. Elevated serum osmolality. Rationale: severe dehydration concentrates solutes in the blood, increasing serum osmolality. The other options are inconsistent with hypovolemia. Question 32. A nurse is monitoring a client with fluid volume excess receiving 4 diuretics. Which finding indicates the therapy is becoming excessive? A. Decreased edema. B. Urine output of 60 milliliters per hour. C. Sudden drop in blood pressure upon standing. D. Clear lung sounds. Answer. C. Sudden drop in blood pressure upon standing. Rationale: orthostatic hypotension suggests overdiuresis leading to fluid volume deficit. Question 33. A client with gastrointestinal bleeding presents with fluid volume deficit. Which laboratory value would the nurse anticipate? A. Decreased BUN. B. Decreased hematocrit. C. Increased hematocrit. D. Decreased serum osmolality. Answer. B. Decreased hematocrit. Rationale: in an active GI bleed, the client loses whole blood, both plasma and red blood cells. Unlike simple dehydration, which concentrates the blood, a hemorrhage results in a direct drop in hemoglobin and hematocrit as the total volume of circulating red cells decreases. Additionally, the BUN typically increases because the body digests and absorbs the proteins from the blood sitting in the gastrointestinal tract. Question 34. A client with fluid overload secondary to heart failure is assessed. Which finding indicates worsening cardiac function? A. Clear lung sounds. B. Decreased jugular venous distension. C. Increased crackles and dyspnea. D. Stable weight. Answer. C. Increased crackles and dyspnea. Rationale: these findings indicate worsening pulmonary congestion due to fluid accumulation. Question 35. A nurse is evaluating a client for early signs of hypovolemia. Which assessment finding is most sensitive? A. Hypotension. B. Decreased urine output. C. Tachycardia. D. Altered mental status. Answer. C. Tachycardia. Rationale: tachycardia is often the earliest compensatory response to fluid volume deficit before blood pressure drops. Question 36. A client with excessive sweating and inadequate fluid intake develops fluid volume deficit. Which electrolyte imbalance is most likely? A. Hyponatremia. B. Hypernatremia. C. Hyperkalemia. D. Hypocalcemia. Answer. B. Hypernatremia. Rationale: water loss exceeds sodium loss, leading to increased sodium concentration in the blood. Question 37. A client with renal failure develops fluid overload. Which clinical indicator best reflects worsening fluid retention? A. Weight gain of 2 kilograms in 24 hours. B. Dry mucous membranes. C. Increased urine output. D. Flat neck veins. Answer. A. Weight gain of 2 kilograms in 24 hours. Rationale: rapid weight gain is a reliable indicator of fluid retention and worsening overload. Question 38. A nurse is caring for a client with fluid volume deficit. Which intervention is the highest priority? A. Restrict fluid intake. B. Administer isotonic 4 fluids. C. Elevate head of bed. D. Administer diuretics. Answer. B. Administer isotonic 4 fluids. Rationale: restoring circulating volume is the priority in hypovolemia. Isotonic fluids expand intravascular volume. Question 39. A client with fluid volume excess exhibits hypertension and bounding pulses. What is the underlying physiological cause? A. Decreased preload. B. Increased circulating blood volume. C. Reduced vascular resistance. D. Loss of intravascular fluid. Answer. B. Increased circulating blood volume. Rationale: excess fluid increases blood volume, leading to elevated blood pressure and strong pulses. Question 40. A client with severe hypovolemia progresses to shock. Which finding indicates decompensation? A. Tachycardia. B. Cool clammy skin. C. Hypotension unresponsive to fluids. D. Increased respiratory rate. Answer. C. Hypotension unresponsive to fluids. Rationale: this indicates progression to decompensated shock where compensatory mechanisms fail. Question 41. A client with advanced heart failure develops acute pulmonary edema. Which assessment finding requires the most immediate intervention? A. Mild peripheral edema. B. Weight gain of 1 kg in 24 hours. C. Severe dyspnea with inability to lie flat. D. Blood pressure of 150/92 mmHg. Answer. C. Severe dyspnea with inability to lie flat. Rationale: orthopnea and severe dyspnea indicate worsening pulmonary edema and impaired gas exchange, requiring immediate intervention. Question 42. A client experiencing fluid volume deficit from hemorrhage shows compensatory mechanisms. Which hormonal response is expected? A. Decreased ADH secretion. B. Increased aldosterone release. C. Decreased renin production. D. Suppressed sympathetic response. Answer. B. Increased aldosterone release. Rationale: aldosterone promotes sodium and water retention to restore circulating volume during hypovolemia. Question 43. A client receiving excessive fluids begins to exhibit confusion and headache. Which condition should the nurse suspect? A. Hypernatremia. B. Cerebral edema. C. Hypovolemic shock. D. Metabolic alkalosis. Answer. B. Cerebral edema. Rationale: fluid overload, especially with dilutional hyponatremia, can cause fluid shifts into brain cells, leading to cerebral edema. Question 44. A nurse is assessing a client with dehydration. Which urine finding is most consistent with fluid volume deficit? A. Pale yellow urine. B. Low specific gravity. C. Dark concentrated urine. D. Excessive urine output. Answer. C. Dark concentrated urine. Rationale: in hypovolemia, the kidneys conserve water, resulting in concentrated urine with high specific gravity. Question 45. A client with fluid overload develops decreased lung compliance. What is the primary cause? A. Airway constriction. B. Fluid accumulation in alveolar spaces. C. Increased hemoglobin concentration. D. Reduced cardiac output. Answer. B. Fluid accumulation in alveolar spaces. Rationale: fluid in the alveoli interferes with lung expansion, reducing compliance and impairing ventilation. Question 46. A client with prolonged dehydration develops acute kidney injury. Which mechanism is responsible? A. Increased renal perfusion. B. Decreased glomerular filtration rate. C. Increased tubular secretion. D. Enhanced electrolyte excretion. Answer. B. Decreased glomerular filtration rate. Rationale: reduced circulating volume decreases renal perfusion, leading to decreased GFR and kidney injury. Question 47. A client with fluid volume excess is at risk for which cardiovascular complication? A. Bradycardia. B. Decreased cardiac workload. C. Heart failure exacerbation. D. Reduced preload. Answer. C. Heart failure exacerbation. Rationale: excess fluid increases cardiac workload and preload, worsening heart failure. Question 48. A nurse is assessing trends in a client's fluid status. Which change is most significant for fluid volume deficit? A. Weight loss of 1 kg over 24 hours. B. Slight decrease in blood pressure. C. Mild thirst. D. Decreased appetite. Answer. A. Weight loss of 1 kg over 24 hours. Rationale: rapid weight loss reflects significant fluid loss and is one of the most sensitive indicators of hypovolemia. Question 49. A client with fluid overload is being monitored. Which electrolyte imbalance is most likely due to dilution? A. Hyperkalemia. B. Hypernatremia. C. Hyponatremia. D. Hypercalcemia. Answer. C. Hyponatremia. Rationale: excess water dilutes sodium concentration, leading to dilutional hyponatremia. Question 50. A client in severe hypovolemia shows signs of organ hypoperfusion. Which assessment finding best reflects this complication? A. Warm flushed skin. B. Increased urine output. C. Altered level of consciousness. D. Bounding pulses. Answer. C. Altered level of consciousness. Rationale: decreased cerebral perfusion leads to changes in mental status, indicating severe hypovolemia and organ dysfunction.
You just completed one of the most clinically demanding breakdowns in fluid and electrolyte nursing assessment. If you were able to confidently differentiate fluid volume deficit from fluid volume excess under pressure, interpret subtle assessment cues, and avoid the common traps, you're no longer thinking like a beginner. You're thinking like a nurse who can prioritize, detect deterioration early, and act fast. But here's the truth. On exam day, the difference between passing and failing isn't knowledge alone. It's precision under pressure. So don't stop here. Train your brain to recognize patterns faster, think critically under stress, and master the kind of questions that most candidates get wrong. If you want more high-level drills like this, the kind that actually prepares you for real NCLEX difficulty, stay consistent and keep pushing your limits. Your next level starts with the next question.